and today I'm going to talk about very interesting, very excited and very hot topic that we receive a lot of inquiries in our clinic, PDO threads lift. But I also have today a very interesting guest with me, Dr.Jaques Otto. He's absolute expert in PDO threads, and that is the person who taught me PDO threads in first place. And actually, I think because I have had a great teacher, I able to deliver the great, safe, and predictable results with PDO threads to my patient. However, that is such an interesting topic, and many patients have a lot of questions, a lot of fears, and also realistically, they want to come to the most reputable practitioner and clinic. So Dr.Jaques Otto will help me today to answer most common and most important questions that patient may have who consider PDO thread lift. So hi, Dr. Otto. It's very nice to have you with me again, and thank you for taking part in our video.
Hi.
So, Dr. Otto, I first of all want to ask you, how did you introduce PDO threads into the UK? Because if I'm not mistaken, you are the person who first brought PDO from Far East into England.
Hi, hello, Dr.Olha. Thanks for the long and nice introduction. Yes,
You're welcome.
I introduced or pioneered the barbs or the cogs into the UK. The year before me, there was somebody who introduced the skin threads, you know, the little skin threads, but they mainly for skin rejuvenation. But the real lifting effect from the barbs or the cogs, I introduced in 2013 already in the UK. And then started teaching as well later on. So yeah, it goes back nearly almost 8 years now when I started.
And I think so. Last year I went to Paris to IMCAS Congress, and made me realize once again that PDO threads is not widely popular in UK in comparison with other countries. Would you be able to explain why is that? Why UK seems to be a little bit behind with the PDO threads in comparison to European or Far East countries?
Yeah, if we take the Far East, it's by far the most popular, right? It started mainly in Korea, went to the other Far Eastern countries, and it's the #1 thread that they use. I think the problem with the UK was around about 2012, 2013, another, I'm not going to mention the name, type of thread competitor was introduced, and it was mainly introduced into the industry via plastic surgeons. So they did some treatments. The results were not long lasting. There were some problems associated because those threads break easily. So the word that went out from the surgeons were threads don't work, right? So, and I've been on many conferences in the UK speaking, and I always hear this comment, and I say, well, you must please define what you mean by threads. You must define what type of a thread. Is it PLLA threads? Is it polydioxanone threads? Blah, blah, blah. There are many types of threads. You cannot just say a blanket remark that threads don't work. I said, that's #1. #2, it's also technique dependent. You know, if you just putting in a few threads, yes, it will last 1 or 2, 3 months, and that's it. So it's important that enough threads are inserted, whether it's PDO or any other type of thread. So for example, in the Far East, in China, in Thailand, they will say to me, I want 10 this side, 10 this side. In the UK, if you're saying that, people think you're crazy. Why do you need so many? But the principle of PDO threads is you're inserting the thread, and with the barbs, you're creating a lift. But over the next 6 months, while the thread is being absorbed, the body lays down collagen in the place of the thread. So if I put my fingers here, when the thread is gone in 6 months, I have new collagen formation. So it is well understood by the doctors, all the practitioners and the patients in the Far East that the more you put in, the better the result will be, or longer lasting. What I also found is that originally, I think the original claims made by companies, oh, these threads last 3 to 5 years. So again, that's not true, because it's depends on the patient, the quality of the tissues. When I see somebody 40 years old, slight sagging, just a little bit of skin loosening, a little bit of platysma action, then it's easier to treat. If it's somebody 65 who was a smoker all their life, and really the skin is loose and really full of wrinkles, the results cannot last so long after a single treatment. So what I realized is I started introducing within 9 to 12 months to try and do a second treatment, even if it's less threads. But I re-stimulate the collagen reaction and I reboost it, and I actually treat on top of the collagen with better anchoring, better lifting, the second treatment. So I found if within a year, 15 months, 15 months, you're doing a second treatment, then you get longer lasting effects. But then I've had patients, I've had one treatment, this is 5 years now, and they're all still happy. So it's difficult to say everybody is going to respond this way. Even in surgery, you can have a very best plastic surgeon do a facelift. Some of his patients, a year later, 2 years later, the effect is all gone. You know, so it's hard just to guarantee. I never guarantee. Also, I believe in combination treatments because this part of the face, platysma muscle, is responsible for the sagging and the jowl formation. So I always combine botulinum toxin with thread lift, and that gives me better results. So I don't know if people have different, techniques, but I find that's the best treatment.
I very much agree with you. I apply same approach. I quite like the platysma band to be relaxed with botulinum toxin,
Yes.
and also have maybe few threads across the jawline, which nicely
Yes.
tighten the jowls area. And
Yes.
I couldn't agree more with you. I think it's very much down to correct case selection, because not every patient is a candidate for PDO threads.
That's right.
And I know, Dr. Otto, you taught me PDO techniques, but I also, as any practitioner who's started implement training into practice, so what I realized from my own practice, the minimum amount of thread when I recommend to the patient, if we're talking about full face, it will be 5 on each side. That is kind of a good point to start. But you're very much right. Sometimes we need 10 if the patient is heavy, if they develop sagginess. We can't work with less than this because the result wouldn't be there. I absolutely agree with you on that. But so that is important point to take in consideration, I think, for people who come to the clinic and they have probably previously been recommended to have 1 or 2 threads.
Yeah.
And we have patients who come and I have had PDO thread lift, but it didn't work for me. And then you ask them how many threads you have had. I have a patient who came and said, I had 1 thread, 1 on each side. And it explains why it didn't work. So I think multiple factors like patient selection, number of threads, and also practitioner technique.
Yes.
And actual threads as well.
Yes.
So I wanted to ask you the following question as well, because Dr. Otto, I have been very happy with your threads and we actively use them in the clinic. But also there is a certain types of threads that could cause a little bit more swelling, post-treatment swelling, and recovery is much longer. Would you be able to advise why is that? Why certain types of thread settles beautifully and certain types of thread cause more post-traumatic stress to the tissues?
Yeah, I must find, if I take my personal experience, when we started in 2013, 14, the gauge was a 21 gauge. So it was a thin bar, quite thin bar. And what I found, even down to the 19 gauge, if the cannula gauge is very thin, you tend to go closer to the dermis, right? So near the skin, you can catch the skin. And in those days, we got a lot of puckering that was very difficult to treat as well because of the thread being too close to the dermis. Now with the multi-directional 6-dimensional thread we use, has got more barbs, it's thicker. It's a 1-0 or a 2-0, 18 gauge or 19 gauge, but there's no puckering, number one. Insertion, even though the cannula is thicker, is almost easier because we are further away from the skin. So you're a little bit lower underneath the skin. You're not catching the dermis, right? So it's easier to insert. And then the swelling now is almost negligible. If I compare my patients of the last, say, 2 years, this type of thread we're using now, compared to previously, they had to sometimes take anti-inflammatories, although I recommend not to take it because it suppresses the new collagen formation. And they were complaining of pain. They had to take painkillers. Now, I say to patients, listen, if you need something for discomfort, maybe take some paracetamol. And the feedback I get from them, I never needed it. So it is the type of thread we're using now. I don't know what other companies do, and they say they have PDO threads because it could be the design, the barb design, but I find we have better anchoring, better holding, better lifting, less swelling, less pain, and better results. So I cannot change this, to anything else. We had our input with the manufacturer. I met him actually when I was, I think 3 years ago in Monaco, 4 years ago. And I said, listen, you look like a very good company to me. I want you to make me a thread like this. And they said, okay, we'll get back to you. 6 months later, they came back, they say, test this. And we've not looked back, so you would normally think, oh, 18 gauge is a very thick cannula and it's going to be difficult to insert. The most important thing about the technique is your entry point. If your entry point is not correctly prepared, you cannot get the cannula in, even if it's a thin cannula, you know that. And if the entry is too parallel, you're catching the dermis. You must almost like scoop underneath the skin and then go further. Also, I think what helps with less swelling, bruising is because we're connecting to the cannula, the one little syringe with lidocaine. So as I'm injecting, I'm giving a little bit, small volumes, if there's discomfort. I'm not injecting from outside, causing more bruising and swelling. So yes, in general now, our results are definitely better, longer lasting, more patient satisfaction, less pain, So there's no reason for me to even try anything else. I'm happy, I always say if something works, why change it? If you have happy patients, because that's the most important thing, patient satisfaction, and they're referring more friends, so then you're on the right track. I know there are many new, I heard the latest marketing, how would I say, selling point is some company claims that if the thread is cut by laser to make the barbs, yes, it causes more swelling and problems, or when the thread is just molded. No, it doesn't make sense to me. But they're trying new selling techniques, to say, oh, my PDO is better than the other PDO. Yeah, I would say it is the multi-directional and 6-dimensional multi-directional. Yes, you need a grip and the thickness, So the thicker the thread, the more collagen formation you're going to have as well. So that's where I stand. I've not used, I've been tempted many times. I've had companies coming to me, please try our thread, just try it. And, I do some research and I say, well, I can't see the benefits really. So why must I change?
No, I absolutely agree with you. And I have had tried other threads and I compared them with your threads, and definitely a response from the patient, and I observe much better recovery and much greater lift. So I agree with you on that. So if something works, you should work with the products that works for you. But you mentioned about technique a couple times, and I know, and I mentioned that you teach medical professionals in threads. So could you just explain to basically general public, how does it work? Because a lot of medical aesthetic courses are a day courses, and PDO is invasive procedure. So sometimes you work with different level of people who have a different level of experiences in medical field, in medical aesthetic. How do you usually think how much training the person need before they are safe and competent to do the treatment?
I think the most important is, and I can see this across the spectrum of medical, especially doctors, right? It's like, for example, general practitioners, they don't use their hands a lot. They write prescriptions, most of them, and do examine the patient. Nurses, and dentists, they're using their hands all day, right? So especially dentists, you know, you do a lot of precision work with different instruments in your hands. So your hands are learned. I call it like there's a brain connection with a hand. So what I find is, well, it's a prerequisite for me, or requirement is, people must at least have experience of cannula injections in the face, and not just doing a little bit of lips, right? A little bit of Botox. I'm talking about doing cheek augmentations, right? Chin augmentations, jawline, where they're looking at a face and analyze the face and say, okay, you know, somebody can come to you, oh, I want my lips like Angelina Jolie. There's the photo, right? Okay, so you're focusing just on the lips. But if you are doing cheeks, nasolabial folds here, you have to look at the face in total, and you have to plan something, and you have to think, okay, I'm going to need this side 3 ml, the side 2 ml, or whatever, because there's always some asymmetry. Nobody is symmetrical. You know, as a dentist, when you've lost some teeth, you're going to have problem on this side, less volume. And with age, we have bony changes, we have soft tissue changes, we have the platysmal muscle shortening. So I want experienced people who can assess the face. It's no use, oh, I can do threads and start putting them in, and you don't know what you're doing, right? So I need some sort of experience where they can use a cannula, a fairly long cannula, you know, when they're doing like filler. So, and they get good results from doing fillers. So that to me is, okay, they know how to use a cannula. Then it is easier to teach the threads insertion. But the problem with the thread is you have like one entry point maybe for 5 threads. So they'll have to come back each time. And if the entry point was not prepared correctly, then it's going to be very difficult to insert the threads. So the other part of the technique is, once we've inserted the threads, we also tighten it, right? You remember that? So I turn the threads a few times, and that gives you additional lift. And then you make sure that it's gripping up in the top. So it's not just, oh, I'm putting in threads, let's wait and see if we're going to have a lift in 3 months. If you do not have immediately a mechanical lift, so I always, when I treat the patient, do the one half of the face, let them stand up, we're standing in front of the mirror, and they can see the difference between the two sides. Then they can see, right, there is a lift. Because I find many times patients afterwards say, oh, I can't see a big difference. They already forgot really what they look like. And there's a big difference. So important is the before photographs, halftime, I call them halftime photographs, and at the end. And I also do photographs on patients' own phones for them. So I say, the way you must do, if you want to send me a picture in a week or 2 weeks, you can't hold the phone there and take a photograph and pull your face like this. It has to be the standard approach, right? Like this. You can ask anybody to do it. So they have a photo when they go home. And I find otherwise, if they forget very quickly, right? If there was an effect, or they don't think it's worked very well. So that to me is very important, is that practitioners need to be experienced. The other thing is the law has changed, as you may know. And if your clinic is not Care Quality Commission registered, you can't insert a thread, not even a skin thread. We get many practitioners calling us up, oh, but I'm only doing monos. Sorry, look on the CQC website. This is now regarded as a minor surgical procedure, which I think is right, is correct. It is a minor surgical procedure. So it should be experienced people, number one, doing this, right? And the law requires, that's it. So there's no more arguments. If anybody is doing it in a clinic, so the members of the public can request from that practitioner, is your clinic CQC registered? No, then you're doing it illegally, whether you are good at it or what. So there's the first obstacle is the law. And then the second thing is you must find an experienced person, you know.
Absolutely. And I'm very, very pleased that this law has been introduced.
Yeah.
And I think that is hopefully the first right step on regulating medical aesthetic field. I'm very worried when I hear that some people who have no medical qualification practice PDO, and we get it, I think, in all areas of England. Sometimes patient comes and they ask question, why are you charging this cost when someone on Instagram does it for a couple £100? I would say my message to everyone who see a PDO treatment advertised for a couple £100, it's probably the first signs that you shouldn't be going there because it's not the genuine and good quality product, and certainly not a safe practitioner.
Yeah, the thing is, people can buy off the internet anything. You don't know the source, and there's a lot of fake products, so you might be thinking, I'm getting PDO, or this person is doing PDO threads, or that person might also be thinking if they're inserting PDO, but it's not. So you must, at least us as practitioners, we must verify, make sure that the product we're inserting as a valid CE mark, or I don't know now what Brexit, but I'm still thinking that is the case. And for us as doctors, it's no excuse if I say, well, I assume because it says CE mark on the packaging, I have to check, because the GMC can hold me accountable if they believe I inserted a non-CE mark product. So yes, if you're saying that, why is the extra cost? We have extra checks to do. We have proper clinics to run. Our CQC registered clinics have to comply with minimum standards of safety, of cleanliness, of everything. There's, even a fire master, we have to have this. We have to have everything. We have to have electrical certificates. So if number one is any procedure to the member of the public must be safe. And number two is effectiveness, right? It's not that, oh, this is the most effective treatment, but it's unsafe. Doesn't matter. So if I want to go to you or somewhere, I will ask this question. Oh, you're CQC registered. I will already have some reassurance, right? Then the next question is, how experienced are you, right? Okay, you have done many. And I remember, I trained you as a trainer and you trained. So for me, I would say, okay, you were trained to do it and you're a trainer. So you must have more experience than people who are just doing it. For example, myself, I think I stopped counting at 600 practitioners I trained. And I thought, why do I have to continue counting? But so the thing is, and when we train people, they bring their own models so they can check on the model afterwards, feedback from the model. You get other institutions to train and you get these models, they're like almost professional models. They go for, for training and then they disappear. You never see the person again. So the trainee has no feedback, What happens in the first week afterwards, 2 weeks, 3 weeks. So that's why my model is like this. They must bring a model, or they must at least have contact with a model afterwards. So if there's a problem, the model contact them first, so the practitioner can know, okay, this is swelling or bruising or puckering or whatever, and then they can contact me. But I don't want the model to come straight back to me straight away, because then the other person learned nothing, from the situation. Because it's easy to do something when it all goes well, but you really start learning when you're having some problems, And medicine, is not exact science.
Absolutely. And I think that is a very good learning point if because I do teach PDO as well, and I teach with cosmetic courses company, PDO threads. I teach for them. So I believe it is certainly a good option if the delegate can bring their model and then they can reflect on the treatment, they can monitor their models, they can see the result. I think it's a great learning experience. And I know that some practitioners, they said that they can't find the model. I believe that if you're starting to introduce a service or treatment to your clinic and you can't find a model for the treatment, then how are you going to offer this service to your patient? I believe everyone who practicing aesthetic can find a good case study for themselves, and it's a very good learning experience for them. I think it's really good model. But Dr. Otto, you mentioned about it's great when things going well, we're all very happy, but what if not? So, and I believe you probably have, as expert practitioner, and if you have trained hundreds of medical professionals, I'm sure you have seen a negative side and complication side. So how worried we should be about complication with PDO?
The first problem is, and I've had it many times, I've trained somebody, a week later, they are trainers as well. They have say they came to me Saturday, they set up an academy, and the next week they are trainers. They've not even trained maybe more patients in that week. So they see it as a quick way to make money. And I've had cases where they call us up and say, please, can we show you the video? Then he's the trainer and he cannot teach the people he's training. And I said, sorry, I don't want anything to do with that. You haven't got the experience to be a trainer. You've not done patients. You just want the money. So these unscrupulous people who done 1 day's training and next week they train us. That's one of the problems we have with not the threads don't work or the complications, right? What complications? Infection might, I've seen just a few over the years. So originally, remember, we said they should take antibiotic cover, right? But then many patients don't like to take antibiotics. So I say, okay, I'll give a prescription. If you think there's infection, take a photo, call me, or show me a video. If it's warm, you know, I give them all the signs of infection and you start taking the antibiotic, because I find the GPs are reluctant, or they won't even see a cosmetic patient with complications, let alone just giving an antibiotic. So I understand that. I don't want to burden them. They are already busy in the clinic. So that's number one. We worry about possible infection. Over the years, personally, I've had not one patient with infection, right? So the technique when you're inserting must be clean. You have the hair out of the way, you know, and I use alcohol. So use a clean technique. Number two is, yes, so if some patients say, yeah, they want the antibiotic, I give it. So if they have a medical condition where they maybe require antibiotics, I will give it. The other thing is sometimes herpes, you know, simplex, you know, when you're doing something, you trigger it off. So you must make sure about the history, what it is. The ones that I have found that cause problems is, especially if they've had polylactic acid injections, you know, the Sculptra, that one, because it's got, so you must be very careful. If they give you a history of that, I'm very reluctant to insert the threads, because, you know, it can take 5-7 years for those granular or granuloma to start flaring up. So that is one of my and the ones I have seen, or other practitioners have done them coming to me, have this problem. You know, they've had Sculptra before, and then you know, sometimes some other types of fillers where there's collagen production, you know, I can't remember some names. So I see that sometimes with combination, you know, or there was another product beforehand. And one thing I found, article, I'll send it to you. I found now that there's a publication where they say HA, hyaluronic acid, tends to break down the threads faster. That I never knew. So that's something, so that's just for longevity, right? I've seen a few, I will count on my one hand, 4 or 5 over the years, that develop granulomas. Then, because what happened? No, they put a cock down, right? But there was a lot of puckering. Then that barb was too close to the dermis. And then I have seen some granuloma formation. So these patients might be prone to developing granuloma easily. They've never had it before. But I find that if I inject it with some steroids, Kinolog, it dissolves it. But what I will do is, where the granulation is, I will go with a needle underneath the skin and release, and I find the thread is almost attached. So I release it. And when I've released it, and I give one shot, I don't give oral steroids, I don't think it works, a little injection, and then it dissolves. So I've not seen, and sometimes you're thinking, ooh, there might be some scarring. I've not seen scarring, you know, long-lasting scarring. So I've seen some granuloma, I won't say keloid, granuloma formation. I think about 2 or 3. So of the thousands that are being treated, I don't know if you in your practice, what type of complications you see. What I see is puckering maybe, or like you say, not enough threads, and the one side doesn't look the same, you know, it's the other side. But in general, you know, I'm not seeing, and I've had a few referred to me with infection, then the thread was migrating. So then again, it's technique. So, you know, when you're inserting the thread and they're not cutting it and the skin is covering it, the thread can migrate out. So I've seen, I think 2 or 3 where I take a photo, there's a bit of thread sticking out and there's a bit of local inflammation. Then I say, listen, take out the thread and put the patient on antibiotics. And we've had one patient, it was a trainee came, treated the patient, went back, I think Warwick, Midlands. And this patient developed about a month later, like an infection, not immediately. And it was not easy to treat, but she had autoimmune problems. So I think be careful when the patients have autoimmune disease. If they're already on steroids, I don't think they're going to be able to make enough of their own collagen. So I always say to them, listen, I don't guarantee your results at all. If you want it, sometimes they want it just for a wedding in a month, right? They say afterwards. Okay, so be clear when you're doing the consultation. What is the patient intentions? how long, do they want a long-lasting effect? Then they have to do repeated every year, maybe the first year 2 or 3 times. No, but now and a year later and maybe a year later. Myself, I've had it 4 times and it was every December, right? I just checked it on myself. So any treatment, you know me, if I don't have not had it, I don't offer it to the patient.
Well, Dr. Otto, I hope you haven't done it for yourself.
Yes. So, and
and
in your experience, what do you see? Because you were a trainer as well. What do you normally see as a problem?
Doctor, it's a good question. So you mentioned about complications. So, and what we see in complication side. So I'm very, very pleased and proud to say that since 2016, since I introduced threads in my clinic, I haven't had any single case of infection, but we do prescribe oral antibiotics. We only prescribe, and to be honest, sometimes I might not prescribe if we just placing few threads for additional tightening, but if we do a full face or neck lift, antibiotics is a part of our protocol. Have had very few cases that I probably could count, I would say about 3 cases where thread was found a little bit more difficult to settle in patient. I don't know if it's the right way to say a floating thread, so that it hasn't been rejected. It hasn't been trying to come through the skin, but you could feel that like part of this thread is fully attached to the subdermal layers, and the part is a little bit feels mobility in it, so it's not it doesn't have this anchoring effect into the tissue. But again, with a good manipulation, it has been managed. I had also 2 cases where patient body rejected this thread, and that was one with monothread, where thread, and it, I wouldn't say it's a complication because it's probably minor side effect. Patient contacted us saying, oh, I have like ingroin hair. And she came to the clinic and we easily just removed the thread. And usually this type of thread have any resistance. And then we had, again, similar case, but this patient had immunological response to fillers in the past. And that was the reason why we made the next treatment choice threads, to avoid possibility of same reaction again. And she had, again, few threads has been rejected, which was very easy to remove. We have been approached by few trainees that had some side effects in the clinic. And once I see not very pleasant picture where one person approached me, they have had a patient with the side effect of the thread, which was a superficial placement that caused possible puckering and some infection, because it was a look like of an early scar tissue developing. But generally speaking, I think overall it is quite safe procedure if it's done with a good product, with the right practitioner, and with aseptic practice.
Sure. It's, you know, it's like most treatments, even surgery. If you have a young, inexperienced person and they suddenly think they can do very advanced types of work, there will be problems. So I always say, when I'm teaching, I say, okay, I can show you the principles, how it does, but what you must be worried about, the possible problems. And if you're not ready or prepared to handle complications or side effects, then you shouldn't do something, you know. You must be prepared to do the 90%, 95%, no problems, but that 5%, you must be able to treat that as well.
And Dr. Otto, the very last question that I wanted to ask you, which is related to PDO. We mentioned that it's very beneficial to combine it with botulinum toxin in the neck area, but do you combine it with other treatments as well? What could be quite effective in combination with PDO?
Yeah, you know, people always ask me about lasers and RF. Then I say, listen, do it before or about 8 to 10 weeks after, because the heat producing devices can denaturate the threads, and they can break up, or they can sort of change their shape and things like that. So that thing, okay, sometimes when I do a lift and there's quite of asymmetry, like cheek asymmetry or whatever, I will say, okay, come back in a month's time. And in a month's time, all the swelling will be subsided. There won't be, then I can look again. Maybe you need some filler, say in this cheek or somewhere. Then I prefer to use Radiesse because I think, I inject it deeply. So I'm not coming close to the skin. I think it gives more volume, longer lasting. And there's some new collagen formation as well from Radiesse. Like I said, that paper came out recently, end of last year, saying hyaluronic acid can break down the threads through hydrolysis, right? So I'm trying, if somebody's had, say, fillers in the cheeks look nice, and I maybe just do a lift here, I'm not going through the fillers there, it's okay. So I'm trying to, and after a month, when I'm doing a filler, I will not put a HA in, hyaluronic acid, I will put in Radiesse. So my combinations are definitely botulinum toxin. Even if you want a brow lift, I will knock out the orbicularis oculi on the side, so the frontalis lifts up, especially the lateral aspect. So yes, I use botulinum toxin definitely down jawline into platysma bands, even DAO and mentalis. So I will inject like the Nefertiti, the whole jawline. And I prefer to do it 7 to 10 days before the threads. So let it kick in. Sometimes the patients are so happy, say, I don't think I want threads anymore. And then I say, it's up to you, because I always warning them. I say, you might be so happy with your Botox results, you don't maybe want to do the thread. So I never try and push them to have it. I want them to be sure they want the thread treatment. So if they're finding, wow, I like my jawline now, that's it. And then so first I do the botulinum toxin 7 to 10 days, make sure I'm seeing already some result. I can feel the bands are not so tight. And then I will do the lifting another month before I do fillers, maybe, nasolabial, like a little touch, cheeks. It's small volumes, not as big as when you're only doing fillers to getting a facelift. You need a lot of volume, right? Filler volume. But if the threads are there, you might need a lot of less. So I review them definitely in a month. I try and say, come back in a month. If there's any problems before that, they must, patients must come back. I always invite them back. But within a week, it can still be a bit swelling. And bruising is minimal because we're using cannula. So maybe at the entry point, there can be a little bit bruising, but the hair, the hair can protect that. So in the early days, we were injecting externally, right? Numbing the face up. He bruised because we were doing multiple injections, where now at the entry point is the only injections with a bit of adrenaline. Then when you're inserting the blunt cannula, you get less bruising and swelling. Yeah. So that's my combination.
I will share with you my technique. I give patient infiltration dental anesthesia. So I give them infraorbital block, and I wouldn't say dental block because with modern anesthetic, infiltration anesthesia is sufficient, but because it is from inside the mouth, again, it's minimize the bruising and patient feel quite comfortable and relaxed. And I find it's minimized the amount of anesthetics that I require in soft tissue, because the most sensitive area I find is basically your lower third of the face. So as we come in towards the lower third of the face, that is where patient develop more sensitivity. But well, Dr. Otto, thank you very much for your answers today and for your time. And I hope probably would summarize it that if patients who are watching this video, important thing is first, only go to medical professionals, CQC registered clinic, and do a good research before making a decision about having a PDO thread, because it's not just a simple facial procedure. I would say it's probably the closest way of how we can get to a full facelift without surgery.
Yeah,
Would you agree with me, Doctor?
I agree with you 100%. And if my last little input will be cheaper, less threads is definitely not better. You rather have enough threads and pay enough money for it, but done by a properly experienced practitioner in the right clinical setting. That's the approach to be. Don't go to somebody's home who's just putting 2 or 3 threads in and ask you 100, 200 pounds. It can't last, and it's the risks are just outweigh the benefits. It's not advisable. So
Well, thank you very much. Thank you.
Like always, nice. Bye-bye.